Welcome back to the Healthy Dose Podcast. I'm Dr. Joe Gambardella with my co-host, Dr. Buzz Korth. How you doing, Dr. Buzz?
Excellent.
All right. Hey, we are very pleased to have Dr. Ben Erb with us today. He is the lead doctor at APMR of Miami. All your neck pain, back pain needs, this is the place to go. He's not only one of our lead doctors, but he's also a patient.
I am.
I think on the show today, it's going to be a really good thing to actually speak to someone who's gone through the protocol, who's had a severe injury before and has not only recovered, but has thrived and is able to do amazing things that he thought he would never do, including getting ready to head to Iceland next week because he is a newlywed and he's going out there for his anniversary next week, or his actually ceremony next week.
That's correct.
Can't have a bad back for that.
Dr. Buzz, you up there in Columbus, Ohio at Buckeye Physical Medicine, it's a sister office, you treat almost the exact same things that we do. And I would have to say the baseline of what we see are still, nowadays, it's backs.
Yeah,
people coming in.
Back and neck, low back and neck, that's unfortunately, most people at some point in their life will end up with low back pain or neck pain. And, traditional medicine, whether it's taking, NSAIDs, Tylenol, Aleve, opioids, that does nothing to fix it. So
yep.
Usually they'll end up at our office if they're lucky.
Yep. And really, there's many causes, including just genetics, hereditary things. You could have lived a clean life your whole life, eaten properly, exercised. I don't think Dr. Ben's been overweight in his entire life, and he still had a really bad case of lower back pain. But I'd like, in his words, for him to talk about how it first started.
The first time that I remember having low back pain was, believe it or not, in chiropractic school. I was 23 years old. I went to a gym and decided to do a leg workout. And probably my third and final set of squat with 135 pounds, which at the time I didn't think was that much for myself. I was squatting and got to the 7th rep out of 10, felt a little something in my back. It wasn't really pain, it just felt uneasy. Kept going and finished my workout for the day, and then woke up the next morning and could not move. And that's when I really learned that what severe back pain is like, and went to the student clinic, got it treated. And then now I'm 35 years old, 12 years later, and have had multiple episodes of really the similar thing. And that's something that I've noticed, that once you have a quote unquote bad back, it's going to be there unless you get it treated.
And like you said, Dr. Buzz, this can happen to anyone. This can happen to the average person who's working a 9 to 5, just getting out of their car. It can happen to somebody at the gym. But, what Dr. Ben didn't tell you is that he wasn't just a person picking up weights and doing squats with 135. He was a college athlete. He played football in college at a very, very high level, had numerous records being a running back in his high school. I don't want to do all the talking for you, Dr. Ben, but this is probably one of the things where some of the wear and tear over time kind of led to an injury that became symptomatic only at the very end.
Yes.
That's something we always go over with patients when they come in. The analogy, the straw that broke the camel's back, when people come in, we always have to dig in deep and figure out when it first occurred, because, Ben, you can't tell from this, Ben's a pretty big guy. 135 pounds is pretty much no weight for him. So it wasn't the 135 pounds. Mm-hmm. It's probably, how many years you play football, you have any car accidents. It's that stuff over time that builds up. And, that 135 pounds was just the straw that broke the camel's back that day. And we see that all the time with our patients. A patient will come in and say, I slept on my neck wrong. Well, how do you sleep on your neck wrong?
Mm-hmm.
I mean, it's just, that's the day it decided to flare itself. It's kind of like when you have a cavity. You wake up one day, your tooth hurts. It's not because you had cake the night before. It's the stuff you've done over time. And that's why, sometimes these conditions take a little while to fix, because although you think it was because you slept on it, incorrectly last night, which I don't even think that's possible, it's something that could have been there for 10 or 15 years.
Yeah. And you mentioned, Doc, that you had several flare-ups, over the years since you finished chiropractic school. Happily to say, you haven't had a recent one, I guess, in the last 6 months or so. Let's kind of delve into some of the treatment they offered you when you were in chiropractic school, all the way up to the last time you had a flare-up just about 6 months or a year ago.
Absolutely. So in chiropractic school, it was really chiropractic quote unquote treatments, and the treatments at that time are chiropractic adjustments, flexion distraction, which is a chiropractic technique, stem and ice, and that's about it. That was really what I was offered. Maybe some soft tissue techniques, such as what's called Graston technique, which is instrument assisted soft tissue mobilization. It's a soft tissue technique, a little rougher than a massage, and that's really all I was offered then. Here at APMR, since my last, I guess, real bad flare-up was about almost 2 years ago. And really the newest things that we got in the office here were prolozone therapy, high power laser therapy, and really have nailed down this decompression protocol. And that's what I've been doing for the past 2 years. And my back has not given me one fit. I mean, 0 out of 10 pain, 0.
Keep in mind, though, most people that have an injury, 80% of people, or almost 100% of people over age 60 are going to have some sort of an injury to the disc. They're not going to be symptomatic, but it kind of sets the groundwork that you're likely to become injured if you don't maintain proper hydration, if you don't maintain a good diet, if your hormone levels are not optimized. But if you're having back pain, neck pain, the first thing that we do in our office is we do a diagnostic x-ray. And like you said, chiropractic and doing these specific techniques will help most. And most people will remain functional at a very, very high level. They'll control and contain a problem. And they won't have to worry about it anymore. It's really the people that have repeat episodes, and when the condition becomes degenerative, that these advanced techniques become appropriate. I was speaking with a guy just before. I hadn't seen him in about a year, in good shape, and he said, I can't understand why my back is hurting me again. He said, I've been working out 5 days a week. My nutrition is good. And what I told him is, I said, think about this. You're doing a lot of work on the muscular system. You're exercising. Your cardiovascular system is strong. I said, but there's 11 major organ systems in the body, including the musculoskeletal. But I think it's appropriate that we call it the skeletal muscular system, because all this muscular work without ever addressing the foundation is really what sets the groundwork for these degenerative problems, right, Buzz?
Yeah, 100%. The way someone explained to me one time is a joint to be healthy, there's 3 ranges of motion with your joint. So if you can see here on the microphone, you can take your finger, and if you exercise it, that's one range of motion, right? Mm-hmm. And you can do a physical therapy where you stretch it a little bit past where I went with the exercise. But then you have that paraphysiological space, that end range of motion. That's where sometimes when you get the adjustment or the clicking or cracking sound. It's very important for joints to go through all 3 ranges of motion to be truly healthy. Because if you just exercise, that's only one area of the motion, and you're never exercising those other 2. And over time, that joint, in particular the disc between the joint, will start to dehydrate with that lack of motion. You can always picture like the bodybuilder guy with no range of motion. That guy's gonna have a bad back because although his muscles are so strong, the joints don't move properly and they dehydrate over time. That's when you get degenerative disc disease. Yep. And so that's why, just regular getting adjusted once a month to make sure everything is not locked up is really good to help prevent these things. Because, if you wait for, it's always better to handle things before they occur, right? Yeah. Come get adjusted once a month, make sure all those joints are moving and you're all 3 ranges of motion. And if you do that, those discs don't degenerate. It's when you don't, that's when you develop problems.
And just to give an example of what you were saying, Buzz, disc degeneration, this is a great model that we use in the office because it does show the disc and it shows the spinal cord and the spinal nerves. And what happens when the disc degenerates is that fluid escapes and contacts the nerve or the spinal cord. And that's when you truly become symptomatic. And this is a disease like any other disease in the body, like diabetes, rheumatoid arthritis, fibromyalgia, even cancer. These are diseases where the body is not at ease. It's not capable of healing. And when it does become degenerative, you need a specific type of treatment to get this injury to heal. For example, when fluid escapes from a disc, it's called a herniation. The analogy that we
herniation, protrusion, bulging,
early stage herniation.
There's all these, yeah.
And the likelihood of this ever getting better by itself is the same likelihood as you trying to get toothpaste back in the tube once it's come out. It just can't happen without the correct type of therapy and treatment. So that's what we started with Dr. Ben, was a specific type of non-surgical spinal decompression that's based on, and we always like to say, we're pretty open-minded, broad-minded. We have physical medicine practices where we have medical doctors and practitioners that practice with us. We have many sets of eyes looking at patients, but the protocols that we use to treat the spine are based on Dr. Norman Shealy. He's a neurosurgeon at Harvard University. He's the most published doctor in the world on non-surgical spinal decompression, how to treat it, how to control it, how to contain it, and how to do it with a very, 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 very high success rate. And that's what we started with Dr. Ben, starting with some simple spinal decompression and laser therapy. And how'd you feel when you got on the table, Doc? Maybe just kind of explain to everybody listening out there, what is spinal decompression? Is it something you do standing up? Are you lying down? Does it hurt?
So spinal decompression is usually a lying down technique. Now, if that's supine, meaning face up, or prone, which is laying face down, will depend on the condition, and that's how we determine that. When you lay down, you get strapped in. It's really easy harness or belt, almost like putting a Velcro belt over your clothes, and then the machine gently, lightly pulls, so much so that you don't really feel it pull that much. And really, a lot of people fall asleep on there because, number one, they get out of pain, they're lying down, and then getting a stretch that feels really well. And usually they don't have that relief until they lie down, number one, and then when you're actually healing the area, they feel really good, and then they fall asleep. From there, then, when the therapy's over, you unstrap, you come up, and then go to high power laser, which feels like a warming really over the skin. They keep it moving, and then I can't tell you, it's like you were stretched for 30 minutes in your low back, and you get up and you just feel like less inflammation. It feels like your muscles are stretched out for 30 minutes, and you just feel the most loose you've felt in a very, very, very long time, just after a 5-minute treatment.
I know, Ben, you've gone through some advanced laser treatments. Can you explain the difference between, because there's inexpensive or low power cold lasers, and then there's the unit you guys have, the Aspen, like I have, that's a high powered unit. There's a big difference in price. I think our laser is around $40,000 compared to a cold laser. You can buy those as cheap as $2,000. So not all lasers are created equal. Is that right, Ben?
Based on my experience, they're not even close. The low level lasers, class 3, class 3B, or even below, you don't feel anything. And
so if you're treating with a physician and they say they're using a laser, if you don't feel it, then we know it's a low power laser, correct?
Yeah, typically, or they're called cold lasers, and those really do not penetrate any further than really half a centimeter into the skin. Typically, if it's visible light, it's not going to penetrate the skin. And so high power laser, you feel a warmth because there's enough energy to penetrate, even to get a disc, which you're looking to 3 to 5 inches into the body. That's the big difference that you'll feel, warmth versus nothing at all. And if you're feeling nothing at all, some people want to feel something, but those other lasers are very good for scars, superficial infections and things like that, as the laser is antimicrobial. But as far as healing deep tissues such as the spine, the nerves that are coming out of there, and even deep muscles, it's not going to happen with a low-level laser.
And that's important because you have a lesion. The disc, I know you do a good job explaining it. The disc, you have, basically the way the decompression works is it sucks the disc back in, but you have to heal the lesion. Maybe you can explain that.
Yeah, that's the trickiest part about these disc injuries. As opposed to other injuries in the body, you'll have an acute flare-up. They call it the inflammatory stage, where you have stiffness, achiness. You put some ice on it, you rest it, even a broken bone, and it will heal over time. The disc, to give an example too, visually again, once it tears on the backside and fluid leaks out of it, you'll have periods where you feel almost no pain, even without treatment at times. And why is that? Is because as you start to move around, it's possible that some of the fluid may come off the nerve, but the lesion on the backside of the disc never heals. I want everyone to think about that. Imagine you're a kid, you're running around on the playground, you skinned your knee, it's bleeding, or you get a nosebleed, anything, and it never stopped bleeding. What would happen? Well, it's the same thing with these disc injuries. When that tissue is open and it never heals, this fluid is perpetually leaking out. And this is what causes one of two things, either the herniation, the acute, the brand new herniation, or the chronic condition where the disc thins out and dries out and all the fluid is essentially gone from the disc. And this is where, you go to the mall. We've spoken about this in previous podcasts. Christmas time, any time of the year, the busiest place of the mall is right in the middle where all the chairs are. They have massage chairs, and you see people sitting there with big orthopedic stockings pulled up to their ankles, Velcro shoes, canes, walkers, and not one person, not one of those people started out like that. They start out with these injuries. They try to treat them by themselves. But the point that we want to make is this is an injury that when treated properly, you can have a full functional life and not be limited by pain. But you have to do the right type of treatment. The reason why laser is so appropriate and important to treat this disc in addition to the decompression is because the outer tough skin of the disc is very fibrous. Once it tears, though, it does not have the capacity to bleed. So because there's no blood present, there's no oxygen present. And as we know from previous podcasts or just basic anatomy, you need oxygen for tissues to heal. And without oxygen, this tissue never heals. The body can't produce it. So we use lasers. We'll also talk about prolozone, which is an incredible treatment, not only for disc injuries, but any joint pain where there's trauma, dysfunction, pain, where the body's not healing, it's getting worse over time. But as soon as you expose tissue to oxygen, a reaction occurs and the body starts to heal. In fact, you activate the very cells that allow the body to heal, which are called stem cells. I know that's a big area of expertise and passion that you have, Buzz. But we mentioned this prolozone therapy. I'm just going to swing it back to Dr. Ben just to explain the impact that had on his life, and then maybe back to you, Dr. Buzz, to talk a little bit about how prolozone goes hand in hand with stem cells for some of these really chronic conditions.
So it really has been a progression, as you can see, that we transitioned from decompression to laser and then prolozone. And really that's the progression I think anyone should approach to, because prolozone, while it's fantastic, it's a little more invasive. So if people have problems with needles, whatever like that, it does involve needles, but it's well worth it. And really, that's when the true healing, I felt, took the next step. And with a prolozone injection, what it is an injection really into the spine, but it's not, and this is not an epidural or anything like that. But it is getting pretty close to the spine there, where it can do its magic, which is really reduce the inflammation and charge the tissues to start healing. That's when I felt the uneasiness in my back go away. In other words, what's as fearful and as scary as having the back pain was, when's the next episode going to occur? And after getting the first prolozone injection, I can tell you that uneasiness, that shakiness in the spine, the feeling that it was going to go out, went away. And then I felt rock solid that I could return to the gym, that I could return to really my hobbies, such as I love playing paintball, and I was able to get back out there, dive around, jump around, do my thing, and walk away feeling great, not even sore, doing those things. And that's really where it took prolozone, and keeping up with the therapy has taken me.
How would you talk about that, Buzz, about prolozone in your practice?
Yeah, I mean, you can't underestimate the power of oxygen. And if you doubt that, you got to look at a Band-Aid. The reason people have Band-Aids is to prevent fluid from leaking out of your body. But the first thing you notice about a Band-Aid is it's got a bunch of holes in it. Mm-hmm. So why would a Band-Aid have holes in it if it's preventing liquid from leaking out of your body? And everybody knows this because you need oxygen. Because if you put duct tape on a cut, guess what doesn't happen?
You'll never heal.
The cut doesn't heal, mm-hmm. Right? So what happens, and the reason you need oxygen is for these things called stem cells have to have oxygen to release all the good things inside the exosomes, the growth factors, to actually heal wounds. And whether that wound is a cut on your skin or a disc in your back, healing occurs in the exact same way. But as Dr. Joe said, the problem we have is when we get older, past puberty in particular, the joints, tendons, and discs lose oxygen supply. So that's why if a kid would ever hurt their back, like a disc injury, it would heal because they still have vascular supply, they still have good oxygen. But as adults, once we get through puberty, when we damage these, you know, a meniscus, a disc in our back, if we don't do prolozone or stem cells with these procedures, they just never heal.
Mm-hmm.
You know, and you have a bad knee or bad back and it doesn't get better unless you're using prolozone, allografts that contain stem cells, class 4 laser, something to get oxygen to those areas so they can actually heal. And I always tell people, you know, they say, who's a good candidate for regenerative medicine, prolozone, allografts with stem cells, class 4 laser? And really the answer is anyone who's still alive. If you're alive, you have stem cells and you have the ability to heal. But we have to help your body and get oxygen and, if necessary, extra stem cells to that area to help that occur. And that's what we specialize in.
Yep. The biggest things in our practice, although we are phys med practices and we do have medical doctors and, you know, PAs and nurse practitioners, is the biggest thing we prescribe is prevention. Prevention is the best medicine. And for back pain, it's two sides of a coin, and you have to make the choice as a patient, just like Dr. Ben did, where he's in a very physical profession. He's able to, you know, work with patients and, you know, do the things he loves without pain, which is the exact opposite of a person that chooses another type of treatment. So for, you know, bulges to herniations and even the severe radicular pain or pain that travels down the leg, people know it as sciatica, there's three types of treatment that you have. You have the chiropractic, you have the non-surgical spinal decompression, and for the really tough, challenging cases, you have prolozone and stem cells. Think about what the alternative is. You have microdiscectomy, hemilaminectomy, and spinal fusion. All of those are highly invasive surgical procedures that will affect your life from the day you get it till the day that you pass. They're limiting, they're debilitating. They're necessary when people have lost bladder function, bowel function. You know, when they're 10 out of 10 pain and it's not relieved by morphine. Those are the type of patients that may be a candidate. But that is not a first choice option. That should always be the last option. It's in the line of therapies that we do, but it's the last, not the first. Because I think you could touch on this, Buzz. Once you do a surgical procedure, you know, you exclude some of the healing benefits and miracle things that we have available to us in our practice to help our patients.
Yeah, and what we see clinically, and obviously we see a lot of people who have already had surgery in our practices. And if someone has a fusion in their back, it's not if, it's when the joints above and below are become damaged and issues. So even if you have a successful back surgery, you know, and people will come in and say, I had surgery, you know, last year, my back feels great. We know that 2 to 5 years later, because when you fuse that, the joints above and below become hypermobile, they become dysfunctional. And it's not if, it's when you're going to have it. And I can't tell you, and Joe and Ben, you probably say the same thing, how people come in and they'll have an L4 fusion. And then 5 years later, they'll have to do an L5 fusion. Mm-hmm. And then 2 years later, they're doing an L3 fusion. Like, it just destroys. I mean, once you go that fusion route, you're a ticking time bomb. It's just going to happen again and again and again.
Yeah, failed back pain surgery syndrome is getting more topical. You know, people hear about it more and more, just like it used to be. We used to hear about fibromyalgia, which are these patients that would have pain, intractable, was resistant to therapy and treatment. Now it's the leading topic is failed back pain surgery syndrome. We hear more and more and more about it, where people are either the same or progressively getting worse after a surgical procedure. Again, there is a place for surgery, especially as it involves the spine. We have amazing surgeons and neurosurgeons that we work with as part of our practice, but it is not a first-line defense. Just like if you skinned your knee, you wouldn't go to an orthopedic surgeon and get a knee replacement. That's kind of the way that we look at it for these types of back injuries, in that if you treat it appropriately, you treat it early, the outcomes are excellent. And that's what Dr. Ben did, more out of necessity, right? You treated it. You grew up in a chiropractic family. I think your only doctor growing up was a chiropractor. And we've seen it now. You're in practice 10 years, Doc. Ben and Dr. Buzz and myself, we're over 20. We've adjusted tens of thousands of people. The conservative things work great. Chiropractic works great. We're able to help so many people. But I think you'd agree, Buzz, we were falling short with the people that were developing these arthritic conditions, these chronic degenerative conditions, where we were falling into the trap that we were little more than pain management until we became exposed to the miracles of prolozone and stem cells. And that is really where our passion lies now. It took us to the next level. Correct.
You know, and right there with it, I would say shockwave therapy and that class 4 laser, like, these are all tools in the toolbox. And if you ask me, you know, you go to a mechanic and ask them what's his favorite tool, I mean, the wrench, the screwdriver, he uses all of them. And I think we use all of them too, whether it's the chiropractic adjustment, the physical therapy, the Prolo zone, class 4 laser, like they're all equally important, because there is no cookie cutter for any back pain or shoulder pain. Everyone's an individual, and it's really nice to have all those tools in the toolbox.
Yep.
Pretty much everything short of surgery we offer at our facilities.
And patients, you need to know this. You need to interview your doctors. You're well equipped now and educated enough to ask your doctor, do you offer non-surgical spinal decompression? Who did your training? Who did your certification? Do you have a shockwave? Do you have a laser? Do you use tissue grafts that contain stem cells? Where do they come from? What's the research? Are they safe? Dr. Buzz is the guy. I know he answers every single phone call and every single email. Dr. Buzz, you're becoming widely one of the, I would say, guru experts in the field of regenerative medicine and stem cells as a national director for Regenerative Labs. Not all stem cells are created equal. When people want to get in touch with you, whether it's patients of ours, patients of yours, just for a one-on-one to know what's the best type of cell, tissue graft to use for their condition, how do they find you? How do they reach you?
Probably the best thing is just shoot me an email, which is Dr. Buzz, so DRBUZZK as in kite at gmail.com. So drbuzzk@gmail.com.
We've touched on it before. There's only two at this date and time. There's two types of stem cells that are legal in the U.S. to use in joint type of therapies. Only two. Don't believe the hype out there. Don't believe when people are saying they're being covered by insurance. If they're telling you that, you're not getting the real therapy. There's two types of stem cell therapy. We'll talk about it more in future episodes. Dr. Ben and myself, we're down here at APMR of Miami, and Miami Disc Centers at 7170 Southwest 117th Ave down here in Miami, Florida. All of your back pain, knee pain questions, we're here to help you. Make sure you check us out at Facebook at APMR Miami and Advanced Physical Medicine and Rehab of Miami. Until next time, Dr. Buzz, enjoy Mexico. Dr. Ben, enjoy Iceland. We wish you all the best for your wedding and many, many more. And we'll catch you all next time on Healthy Dose with Dr. Joe and Dr. Buzz.